So, you have a male anatomy and you're thinking about getting your nipples pierced. Well, I'm going to tell you everything you should know before getting them done. Coming up next on Consultations by a Piercer, episode number 41. For those that are new to the channel, welcome to the Body Piercing and Tattooing channel. Hope you're enjoying the videos. Hope you're finding them helpful and useful, but you may not know who I am. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio, located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. Now, what we're talking about today is male nipple piercings, or those that have a male-style anatomy. Maybe they identify elsewhere or otherwise, that's fine. But if you have the anatomy that most people consider male, this is the video for you. Now, average healing time on these could be anywhere from 6 to 12 months, during which time I'm going to suggest cleaning twice daily using a sterile saline spray. My personal favorite is Neomed's Piercing Aftercare. Comes out in a fine mist. You just spray it directly on it. You don't have to do anything else. However, you might have difficulty finding it. So the other option would be the wound wash version, or the kind that comes out like a squirt gun. If you're using the type that comes out like a squirt gun, I generally suggest adding in and doing compresses. Basically take a clean, sterile piece of gauze sponge, saturate it to the point where it's damp, and then lay it against the piercing for roughly about 5 minutes. If it's, you can also do this with a clean paper towel, but it's not quite as clean. Now, with the just misting, you just mist both sides, let it stay in contact for 5 minutes, and then pat dry if need be. That you want to do twice daily. Now, you're saying, hey, I can't find Neomed's Piercing Aftercare. What are my other options? Main thing you want to look for is that it says sterile on the can. The can is a pressurized can, not like a spray bottle, but a pressurized can. It should say sterile on the packaging. When you flip it over and look at the back, it should say probably some type of purified water, and then sodium chloride, no preservatives, nothing else. If it has other things in it, it's not what you want. The other thing I suggest doing is at the end of your shower, basically kind of stick your chest out, let the water flow over the area for about 30 seconds. What we're doing by doing the saline rinses and cleaning and rinsing in the showers, we're helping we're removing that hard, crusty discharge that collects on the jewelry. It's a normal part of the healing process, and it's not uncommon of nipple piercings to go through stages of 1 week, it doesn't do anything, and then all of a sudden it does it twice as bad as it did the first time. It's just part of the process. We want to remove it so that when the jewelry shifts or moves, it doesn't agitate the piercing. Also, it can be really uncomfortable if it does that. The other thing is if you get to a point where it doesn't seem like it wants to come off, or there's an obsessive amount of it, go see your piercer and have them clean it for you, because there might be something else going on that they need to address. But it's always a good idea to have them take a look and do it for you. Don't go to the cabinet and start pulling out everything that is tipped in cotton and has sharp edges and start digging around in there. You're probably going to cause more damage than good. Now let's start talking about all the stuff you don't want to do. Cross-contamination prevention, which is something you want to do, but it involves not doing things. For example, wash your hands. Well, this is a do thing. Wash your hands when handling the piercing. Always handle it by the ends. The only time you really need to have any contact with the piercing during the healing process is when you're checking the tightness of the balls. Rest of the time, leave it alone. No oral contact or exchanging of bodily fluids on, near, or around the piercing. Keep your environment clean. Keep clothing, bedding, towels, anything that may come in contact with the piercing clean. Do not swim. I know you're going to see conflicting things like, oh, after, 14 days, it's okay, or after 3 months. Here's the deal. Anytime you submerge your whole body in a body of water that's large enough for you to do that and move around, it's going to be filled with microorganisms. You, the person who's been pierced and is healing those piercings, has 2 open wounds, or at least 1 open wound on your body. Chances are that foreign pathogen can work its way into the piercing and then cause an infection. So to reduce the likelihood of infection, do not swim until the piercing is healed. Lastly, keep pets away from it. Don't let them sleep in the bed with you, especially under the covers. Now let's talk about trauma, clothing, and abuse. Don't sleep on the piercings. Try to make sure that you're sleeping on your back or your side. If you're a stomach sleeper, you kind of have to train yourself not to do that. At first, the pain will probably be enough for you to go, ow, that hurts. I can't do that anymore. That's right. A couple of tricks I learned because I was a full-on stomach sleeper, and now I'm a dedicated side sleeper, is first one would be putting a pillow between your legs. Usually that kind of keeps you from tipping over. The other thing is snuggling up to a large body pillow. That'll keep you from rolling over during the night. Do not spin, rotate, or move the jewelry. Do not play with the piercing. Do not poke it constantly to see if it still hurts. Leave it alone. All those things can lead to problems. Clothing-wise is not as big of a factor as it is per se with female nipples. However, you want to avoid things that have pockets or putting things in pockets that are going to be right up against those your nipple. Also be careful of the seatbelt, any type of vest or any type of strap that goes over your upper body. You really want to try to make sure that it doesn't have contact with the piercing because it's not going to feel good. And lastly, just to say it over and over again, avoid contact with the piercing. Leave it alone. It's in the forbidden zone, and everybody cannot touch it or play with it or do anything with it until it's healed. Then you can do whatever you want with it within reason. There's not really a lot of risk with this piercing, but it's always a possibility of losing ends. They do need to be checked on a regular basis. I usually suggest at least once a week. Check them, especially if they're the threaded style. There's also always the risk that if you take the jewelry out or the jewelry falls out, that the piercing is going to close. Even after the piercing is well healed, that is possible. Now let's talk a little bit about anatomy. With men, most of them, but not all of them, will not have developed nipples, meaning that the nipple is more flat or slightly raised, but it really doesn't have like a appearance of being separate from the body, of protruding. In most cases, nipples can be done even if they are underdeveloped, but your best option is if they're developed. We just do it at the base. Now, if they're underdeveloped, we have to go into the areola. Placement and angle. Now, it depends on the anatomy. If your nipples are developed, they should be right at the base, pierced just right there, and kind of flush to the body. If they're underdeveloped, they should be done slightly outside the nipple area, into the areola, behind the nipple. The key with this is trying to avoid the hammerhead effect, where it's like there's two tunnels and this little nipple at the top of it. In most cases, if the placement is just right, you'll avoid that. But in some cases, regardless of how well it's placed, how well you take care of it, just because your nipples developed the way they did, that's the only option you have. You need to speak to your piercer about this if it's a concern. Otherwise, shouldn't be an issue. It should be marked with you standing upright in at attention, arms by your side, feet together, marked with the nipple erect if possible, and it should appear horizontally straight while you're standing in that position. Now let's talk a little bit about jewelry. Jewelry should be a standard barbell, meaning straight, not curved, not circular, but straight. Either threadless or threaded both are a good option depending on what you like. They both have their disadvantages, but they both also have their advantages. Jewelry should be oversized slightly to allow for swelling, usually about 1/8 of an inch longer than the area that we're piercing. These can swell, and the nipple will increase in size as your body heals the piercing, so a little extra room is necessary. You should downsize in roughly about 2 to 3 months to a shorter post, especially and maybe slightly earlier if it's constantly getting caught and snagged on things. You should see your piercer to have this done. They have the proper tools to do that, and that procedure kind of is like this. You take one end off, push the jewelry out, or attach a guide pin and then push the jewelry out with the guide pin, then put the new jewelry on there and push it back in, remove the guide pin, and then close the jewelry. This way, the piercing is never empty, and it reduces the amount of trauma that's going to happen with the piercing. If you take it out at home and try to do it and just force it in there, there's a possibility that you cause trauma, then it swells, then you have to go back to the longer post again. Circular jewelry. Now, at some point, you might want to wear a ring or a circular barbell in this piercing. I would usually suggest waiting a couple years, 2 to 3, before you do that. We want this piercing to be well-healed, seasoned, and matured. Once that healing process is ended, it's no longer an open wound, but it takes an additional year or so for your body to produce additional tissue to thicken up that piercing and also to kind of grow away from the piercing a little bit to make it possible to go from a straight object to a slightly curved object. Now, with the sizing of the jewelry, it should be oversized, meaning that it should be about 1/4 of an inch larger than the amount of tissue that's pierced. The reason is we want the percentage or that part of the piercing or part of the jewelry that's in the piercing to be as flat as possible. If you put really small jewelry in, one of two things will generally happen as far as the width, really small width. It'll either want to just stick straight out and then eventually it'll fall down, or the other possibility is that it'll start migrating downward from the center of the nipple and the angle will change of the actual piercing. It can lead to rejection if left in and done wrong. So really, you need that oversized jewelry if you're going to wear circular jewelry in nipples. Otherwise, stick with the barbells. Now let's talk about pain in the experience. This one can be one of the most painful piercings that a man can get. Most people on a scale of 1 to 10 will say these are between 3 and 8. It really varies from person to person. Me personally, the worst part of it is the forceps. I think with freehand, it's the piercing itself because it's kind of like piercing a balloon. It is a little slower and it looks more painful to me than the forceps. But the forceps feel like, I guess, nipple clamps. At least that's what I've been told. Listen to your piercer and do the breathing exercise. What we'll generally suggest doing is take a deep breath through your nose and hold it, and then exhale when we tell you through your mouth. In other words, smell the birthday cake and then blow out the candles. Like I mentioned earlier, it can be done freehand, but I prefer to do it with forceps. The first thing we do after we've marked it is put you in a reclined position because we mark it when you're standing. And then we take the forceps and clamp the area, flattening out that tissue, anchoring it, making it stable. And it helps us line up the 2 dots so we know that our angle is correct. Needle is injected in and through in one smooth motion. Shouldn't have to stop in the center for any reason. I've had a couple people lately that's like, yeah, the last time I had this done, she stopped in the middle because she said it hurt less that way. I'm like, no, it hurts more that way. At this point, I remove the forceps and then take the jewelry attached to a guide pin and push the needle out, close the jewelry by either threading it on or pushing in a threadless post or threadless end. Apply a little bit of saline just to kind of cool it down and make it feel good or better. And then we're done. Normally, you're going to notice a little bit of throbbing and aching for about, most people about 2-3 minutes afterwards. There might be a little bit of slight bleeding off and on, day or two in some cases. Also, if you bump it, you're going to know it for about the first 2 weeks. Now let's talk about what you should consider. These are 2 piercings in most cases, and I know a lot of people are like, I'm only going to get 1 done. And I'll tell you what usually happens is you get out of the shower every day for about a month and you look at yourself and you see just 1 and you start going, I need to get the other 1 done. But you can do it in stages if that's what you would prefer. The second piercing will always hurt a little bit more than the first one. It's the way your nervous system works. When you get that first one, your body's like, hey, kid, stop this. This is bad. And then the next time you do it again, your body increases that warning. Avoid contact with the piercings. I don't know how else to put it. They're like curb feelers. You don't really realize how often you press your nipples against people, giving hugs, walking through doorways in some cases. Lifting things. Really be conscious of it and try to keep things away from it. I know this is not the first time I mentioned this, but downsize. It will make your life a little bit easier. It's less likely to get caught and snagged. You're not going to have the jewelry sliding back and forth. It's going to be more comfortable, and it looks better. Generally, and like I said, have it professionally done. It's just a lot easier. Lastly, are you going on vacation? If you are going on a vacation anywhere, I don't suggest getting it pierced before you leave or trying to heal it out while you're on vacation. It's usually best to wait until after the vacation or postpone the vacation. And the reason for that, there's a number of them. First one being is that you have no way of controlling how clean the environment you're going to be staying in is. And that is at a higher risk or problem because you might be in an environment that you've never been in before, and there might be pathogens in that environment that you have no immunity towards. So there's an increased risk of infection. The other thing is everybody likes swimming when they're on vacation, and you can't swim. Now, if you have healed out male nipple piercings and you'd like to share your experience in doing so, please make a comment. We like to share here and share with the rest of the community. Let us know what it was like, especially for those that are thinking about doing it and they're still a little nervous about it. Till next time, here's hoping all your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I hope to see you for your piercing needs in the future. Have a good day, everybody. Take care, and we'll see you in the next video.